Our patient is a 63-year-old male with post-polio syndrome. He has 2 out of 5 strength for hip abduction, hip extension, knee flexion, and ankle dorsiflexion and plantar flexion. So our interventions today are going to be focused around the Trendelenburg gait that he presents with in clinic. He currently presents with no assisted devices. So as discussed in the documentation for our assignment, we're hoping to fit him with a knee, ankle, foot orthoses and a cane, a single point cane. Obviously, because we are in the world of quarantine, we cannot do those today. So instead, I have this stick that I'm going to use as a cane, and we're just going to pretend that our patient has a knee, ankle, foot orthoses on for the purposes of today. Our patient's dynamic gait index also indicated problems with level and unstable surfaces, changing gait speeds, pivot turns, stepping over obstacles, and navigating stairs. One of our other interventions already mentioned stair navigation, so we're just going to steer clear of that and focus on our other issues within the dynamic gait index for today's video. In addition to that, we're also going to be breaking apart the gait cycle in order to really break down that Trendelenburg gait and those muscular weaknesses and tackle them head on. So, because our patient has weak hip abductors, knee flexors, and ankle musculature, when he first goes to use this cane, it's likely that the Trendelenburg that he is going to present with is going to result in a hip drop on the left when he puts his weight onto his right side for swing phase with the left leg. So to prevent this, what we're going to work on is we're going to work on shifting weight from the left leg to the right leg and trying to keep our hips level through tactile cues on the iliac crest. So what we're going to be doing is facilitating weight shifting. And as he weight shifts onto his right side, in order to prevent this, he's going to push through that cane to help facilitate activation of his abdominal musculature to keep those hips level and facilitate the swing phase with the left leg. Once we've mastered this, we're going to use that weight shifting laterally to bring that leg forward. And then from there, back up a second, once we can get that left leg forward, we're going to go from heel strike on the left. I lower my camera momentarily. We're going to go from heel strike on the left to toe off on the right. And we're going to work on weight shifting there, getting that active control of what's left of the knee flexors and ankle plantar flexors and dorsal flexors, and using the cane to assist in that rocking motion. From here, once we get good at this, we can use a variety of activities. In this case, I have kitchen spices to act as objects to step over. And we'll work on this for the left and the right leg. So we have our cane and we have our leg. We practiced weight shifting through the cane, and we're going to try to clear the foot back and forth over that object. And in order to progress this, we can use a taller object to encourage the knee flexion on the good leg and prevent the Trendelenburg on the right. So I'll show you this with the patient so you can see the tactile cueing. So first we have weight shifting. So you're going to be off to the side but behind your patient, and we're going to be weight shifting onto the left and onto the right, providing that tactile cue on the iliac crest and encouraging when they go onto that right leg to push through the cane to help assisting in that weight bearing. And once we get good at that, we're going to take a step forward with the left leg, and we're going to go from heel up with the right to toes up on the left. And we're going to get that shift back and forth. Once we get good at that, we'll add the objects in. So we're going to be working on picking up this leg and bringing it over the object. So yeah, just like you're going to step over it here, I'll bring it back. So you're going to step forward and step back. Beautiful. Pushing through that cane to prevent that hip drop on the left. Beautiful. And then once we get good, the next progression would be to do a taller object. So that assesses our stepping over obstacles within the dynamic gait index and also improving gait speed by improving our control of those movements as part of the gait cycle.